What is the ethical role of doctors when patients refuse care? Imagine being told you need treatment to stay healthy, but you decide to refuse it. What should a doctor do in that situation? This is a tricky part of medical ethics. Doctors have a duty to respect a patient's right to refuse treatment. This right is based on the idea of patient autonomy. Autonomy means that a competent person can make their own decisions about health care. Competent patients understand their options, appreciate what might happen, reason about their choices, and communicate clearly. When a patient refuses care, doctors must first check if the patient is truly capable of making that decision. This is called assessing decision-making capacity. It involves seeing if the patient understands the medical information, the risks and benefits, and if they can reason and communicate their choice. Capacity is different from legal competence, which is decided by a court. Next, doctors need to make sure the patient fully understands what refusing treatment means. They must explain the benefits, risks, and alternatives in simple language. Sometimes using teach-back methods helps confirm the patient really gets the information. Doctors should also talk with the patient to understand why they want to refuse care. Maybe fear, cultural beliefs, financial worries, or misinformation are influencing their decision. By exploring these reasons, doctors might find ways to address concerns or suggest other options that fit the patient's values. While respecting autonomy, doctors also have ethical duties of beneficence and non-maleficence. Beneficence means acting in the patient's best interest, and non-maleficence means avoiding harm. If a patient refuses treatment that could save their life, doctors must carefully weigh these principles. Usually, a competent patient's refusal should be respected, even if it leads to harm or death. Exceptions are rare and include emergencies or cases where the patient cannot make decisions. Documentation is very important. Doctors should record the patient's decision, the capacity assessment, what information was shared, and the discussions held. If possible, involving family or caregivers with the patient's consent can support the decision and help ensure proper care. If a patient refuses treatment from one doctor, the healthcare provider should respect that choice but also offer support and alternative options. They are not required to provide treatments outside their expertise but can refer the patient to specialists better suited to help. In the end, the main role of doctors in these situations is to respect the patient's autonomy while making sure they are fully informed and capable of making the decision. They must balance respecting the patient's rights with their own ethical duties to do no harm and act in the patient's best interest. This approach helps ensure care remains respectful, responsible, and compassionate.